Hi, I'm Priscilla Cole with the Geospatial Risk Summit, and I'm on with Ajay Gupta. Hello, Ajay.
This is great to be here. Thanks for having me.
You were just up on stage at the Geospatial Risk Summit this past January, and it's so great to see you. You came in your purple velvet suit coat, and
Right. Well, it was red, but thank you.
oh, was it red?
I just wore it because it's warm, right? It was January in New York City. It can be
Yeah.
cold.
I definitely had some people look at the photographs of the event and saw, like, hey, who is that guy in the cool suit jacket? So you definitely
You know,
made an impression.
well, if I could amend my previous answer, I'd say, well, it was the Hard Rock Hotel. Well, I was just trying to fit in, right?
It's true. You also stood out for being the only healthcare person up on stage, or like actually in the event at all. I was asking you in the prep if there were any closet healthcare people there at the event. But yeah, tell us about that experience. Like, what is it like going to an event where you're the only person representing healthcare?
I think that is something that our industry, whether that's geospatial or health or this sort of geo health industry that we like to be a part of, really needs to address. There certainly are efforts in geospatial health. The group on Earth Observations has a geo health community of practice. The Open Geospatial Consortium has a health DWIG, right? And so there are these efforts, but it's not penetrated widely into industry. I think we need to learn how to adapt what we're doing into the language and context of healthcare. If two patients present with the same symptoms in Saudi Arabia and Siberia, right, they're probably going to have a different diagnosis, right? Because we know the distribution of disease across the world, especially when environments are so different, is not all the same. Location has an impact. And yet geospatial or spatial analytics doesn't play a bigger role. We need to get better at showing providers how our insights can help them treat a particular patient they're seeing right now. Healthcare does look to our other industries, sister industries for learnings, right? So we do like to be places where non-healthcare professionals and professionals from other industries are, so we can learn something. Like, for instance, in manufacturing, the manufacturing sector has done a good job of integrating their supply chain and workforce across the full supply chain. That's something that healthcare needs to learn how to do. We haven't done that at all. And so we hear of shortages and we hear of disruptions in the human factors across the supply chain as well. We also need to learn, again, from manufacturing, how they've been able to modernize their workforce, adapting to automation and robotics, right? I don't know if we have a whole lot of robotics, but we do already see robots in surgeries, right? So we need to learn how to do that. And we can do that when we have opportunities like I had at the Geospatial Risk Summit to interact with professionals in other industries.
People seem to really enjoy about the conference was how many different industries were represented there. And it was a real chance to meet new folks, learn and collaborate.
The finance is probably the best in the world in terms of analytics to predict futures, right? I mean, they make mistakes like everyone, but their ability to take broad sets of data and make predictions on where investments are going to go, which investments are safer than others, and then make trillion-dollar bets, it seems, on that is impressive. And we need to do that, right? We do make decisions on risk stratifying patients across disease spectrums, across populations, but I don't believe that we are as sophisticated as finance, and that industry is one we can learn from. Yeah. One thing I found interesting about just the people you had, we were on stage. I was on panel 2, maybe next year on panel number 1. But right. I think it was Chris Sims from Nearmap that was on stage with me, on the panel with me. And after the panel, just talking amongst us, and he said that his company is a member of the Civil Air Patrol. And I mentioned we're in the middle of a pilot with another company in the Civil Air Patrol on how we can leverage aerial imagery during and post disasters to assess the level of healthcare infrastructure that was damaged by the disaster, and use that to help communities restore the right amount of infrastructure going forward. And he knew the company, and that's that kind of small world feel was right there, right? Two random companies, they know each other, and they're both in the Civil Air Patrol.
It's the kind of thing that you would never get just looking at, like Chris's LinkedIn profile, your LinkedIn profile. Like you wouldn't expect connections like that. It's great when you meet in person and find those organic connections. So I want to ask you about something, because I just saw a post on your LinkedIn feed that had this quote about how there are more people employed in health insurance than there are doctors and nurses. And, we got talking a little bit about, care deserts in places. And so why don't you tell us a little bit about that? It seems like you're really passionate about those topics.
Yeah, because it's clearly an indicator of misplaced resources potentially, right? So we know that healthcare is 20, maybe 20+% of the U.S. economy, which is the largest economy in the world by a huge margin. And we've got a large workforce in healthcare, and yet still we have shortages of doctors and nurses in many parts of the country. And we also have many parts of the country with an absence of care. So one of the things that we do is what we call our Care Desert initiatives. We identify those areas and communities across the country that don't have sufficient access to healthcare resources by service lines, not just hospitals, but hospitals, pharmacies, mental health services, dental services, women's health services, etc. Where there's areas where they don't have adequate access to care for the population that lives there.
Yeah. Yeah, and that knowledge of where those deserts are and why they're there, and like what specific segments, like you would say that's not well known.
It's not well known in the industry to the level you need to know it so that you can change it. I think if you just ask random persons across the country in any socioeconomic status, anybody, that, hey, are there places where it's hard to get a doctor's appointment? Are there places where you have to travel a long distance to go to the hospital or to go to a specialist? Everyone knows that that's true. But knowing that that's true and knowing what you need to know to affect change are a lot different. In the vague sense, can't do anything about it. You need details. Those details on shortages, and I like your question, right? Why?
Yeah.
If you don't know why there's a shortage in an area, you can't fix the underlying problem.
Right. And it's not always just a lack of staff and clinics and things like that. Like one thing that came up when we were talking before, like it could actually be a mismatch with insurance. Like maybe those clinics and doctors are there, but the insurance products that are offered to the people in those regions aren't matching with the services that are there. So it can be very messy, like what all's contributing.
You're right. That gives me, though, a little bit of optimism, right? Because as soon as we say that it's not because there's not enough providers, but there's other things, insurance, there's reimbursements. Those are regulatory things, right? Those are things that we could change very quickly if we wanted to. So I live in the state of Maryland. Maryland, like other states, has a shortage of behavioral health or mental health providers, right? However, there are many in the healthcare in Maryland who say we actually have enough mental health professionals in the state, but reimbursements are so low they just don't take patients. But we can raise reimbursement rates if we need to by providing people who need mental health care and behavioral health care with that care early on is definitely cheaper in the long run than the consequences of those people having those problems unmedicated or untreated long term.
Not only what you need to spend more money on, but where you can have the most impact in distributing those funds. Like such a fundamental, like spatial thinking type of way of addressing those problems. Well, Ajay, I feel like we could go on and on and on. You've been such a busy guy lately. Why don't you just a quick rundown?
Speaking at your conference, Priscilla really gave me the idea to go ahead and write a paper to show how geospatial technologies and AI can influence health risk analytics. And release a number of blogs before the conference and sort of a more comprehensive paper after the conference. We're just releasing a paper tomorrow on how artificial intelligence helps in the healthcare quality and safety space. It's great that all these AI tools are coming out every day, every week. There's new AI tools, but there should be a concerted plan to make sure that what we are building as a community in artificial intelligence is actually going to solve the problems that cause us to start building them in the first place. And I am doing a podcast as well, as you mentioned, the Geo AI podcast. We actually have episodes on a at least monthly basis.
You're putting out so much content. There's so much that people can go and follow up and see that intersection of geospatial and healthcare. There's just so much room for improvement and growth and innovation.
HSR.health, our website to track us. And we're also on LinkedIn and X and everything.
Thank you for being a part of the summit and for coming on again for another conversation. It's always good to talk with you.
Always fun to talk to you, Priscilla. Absolutely.